So, let's look at the gut first. What kind of things do I find with the gut? Well, the first things that I take a look at is, are they backed up? Are they constipated? Are they FOS, full of stool? And you can see over here, when you have dark in an X-ray, dark is like very light and it's air. Dense is bone tissue. So if it's white, it's very dense. In this child here, you can see so much whiteness in the gut. It's not bone, but boy, it sure doesn't look like this. This is almost translucent. You can see through it. This is all stool in the child, okay? This child could be having a bowel movement every day, but not enough to empty the sewer system. You can see stool all the way through. It's even impacted down in here. This is air mixed with poo in there, and that is going to make him miserable. Why is that going to make him miserable? Because whenever we have distension in the bowels, it's sending signals to the brain, you got to do something. And these kids aren't. So it makes them on edge. We've all been in a position when we've been driving where we've got to have a bowel movement. We can't. 5 more minutes till we get home. It's anxiety producing. And these kids don't understand what's happening with that. So why wouldn't we treat that? Well, what I do is when I have a kid who's like this, I'll go ahead and do some laboratory evaluations to find out why he's backed up. Why? Not just treat it, which I will do, but why is he backed up? And these are just some of the laboratory things I do. I'm going to be looking at the stool, I'm going to be looking at the urine, I'm going to be looking at food allergies. We'll be talking about that in the dietary part of this, okay? I'm looking for bacteria, overgrowth, yeast. Well, when you think about it, if you were to take a burrito, wrap it in foil, put it in your oven at 98.6 degrees, which is body temperature, and check in on it in a week, what do you think it would look like? So you can imagine what stool sitting in a child at 98.6 degrees, what won't grow in there? Now these are living organisms and they make their own little poo and pee and that gets into our bloodstream and that will affect our brains in a very adverse way. So that's why I'm saying we need to take care of this. Sometimes I can't get near the child to do a good tummy exam. They're either too ticklish or a little too anxiety prone. So I can get an x-ray of their tummy like I did on that last picture. And then sometimes we actually have to see the GI doctor. So, chronic constipation, what is that in my book? Well, they could have a bowel movement every day, and parents will say to me, he can't possibly be constipated, he has a bowel movement every day. Well, if his body makes that much poop a day and he poops out just that much, 2 or 3 inches accumulate day after day, 30 days, 40 days, 50 days, it can accumulate. So even that can potentially fool somebody saying, oh, my kid's not constipated. But very often they have less than 1 stool per day. I have kids who have 1 stool every 2 to 3 weeks when they come into my clinic. And I'll say, you know, all God's creatures poop every day. What's wrong with this picture here? Okay. Obviously, if they're uncomfortable and bloated in the belly, they're going to have sleep issues too. And if there's no place for the food to go because they're backed up, they're going to have reflux because the stomach's going to squeeze, and it's either going to go down or it's going to come back up. They may have strange food cravings or start putting all kinds of things in their mouth. They're in pain. They don't know if it's hungry. You know when you've been sick and you kind of got over it, now your stomach hurts and you're wondering, is it hurting because I'm hungry or is it hurting because I've just kind of gotten over the flu thing? They're still trying to figure this out too, so they start putting dirt in their mouth and what we call pica, eating things that aren't intended to eat. They get irritable and aggressive. So treatments for constipation, we have to unplug the cork in the bottom. And if the child is will tolerate an enema, it's very, very good to do. But obviously if you have an 8-year-old, you're not going to be able to do that very effectively. Glycerin suppository. Sometimes I'll use polyethylene glycol, also known as Miralax or Glycolax. I like this one because it's colorless, odorless, and tasteless. Okay? And people say, well, that's a chemical, doctor. Isn't there something natural? Yeah, they're called herbs. And herbs are very pungent, very strong tasting, and most of the kids will reject them, unless they're swallowing capsules. I like George's aloe, fiber. All the kids I have are on fiber. Whether they have diarrhea or constipation, they need more fiber in their diet. I can use vitamin C in high dose. Magnesium I love to use as well. These are things that we have to continually do. And when you're treating constipation, it's a 6-month process, okay? The colon is not like the lungs. It's not an elastic organ. So if it dilates up and I clear it out, it doesn't mean it goes right back down to the size of a toilet paper tube the next day. It's going to stay big, okay? And it's going to take 6 months training, which means you have to stay on top of this for 6 months, or you just find yourself back to square one within a couple of weeks. Well, he was moving his bowel so well, so he stopped everything. So fiber helps prevent constipation, which in turns and diminishes the potential for growing things in the bowels. It's called dysbiosis. Right, let's switch gears. Let's talk about just the opposite, diarrhea. Now, I have some families, when I ask in a big group, how many of you guys have kids who are constipated? How many of you guys have kids who have diarrhea? And how many have both? Because you can have alternating too. So this kind of applies to all of our kids who are not moving their bowels well. But you can have 1 to 6 liquid bowel movements per day, and they're usually explosive. They're very foul smelling. They can come in all different colors, yellow, green, orange. They often burn the bottom, so you're going to get these diaper rashes. They can be very difficult to clean up. They just got this kind of oily thing. It's very hard to get off the skin. And of course, they can be painful. Now, we can't get set off track when our doctor tells us, well, this is just toddler's diarrhea. I could tell you that if we took our dog to the vet and the vet told us that diarrhea is a normal developmental process for our dog, my wife would not be very happy with that, dealing with diarrhea from an animal. So why would we tolerate that in a child? So in the process of managing diarrhea, I almost always remove gluten-containing foods. I'm going to talk more about that in the diet, and dairy. I put them on digestive enzymes. My son's stools look very much like children who have cystic fibrosis. This foul-smelling, sandy, gritty stool. And I said, this was 20 years ago. I said, this looks like cystic fibrosis poop. I'm going to go ahead and put them on digestive enzymes, and that really did help. Obviously, removing dairy and gluten also was big for him. Digestive enzymes, antibiotics. If you've got bad bacteria growing in the stools, until you get that bacteria out, until you get the yeast out, until you get parasites out, good luck with getting stools normalized. So very often I actually have to use medications for that. But 80% of my practice, these kids are sensitive to gluten and dairy, and you remove gluten and dairy, and you don't have to worry about all the parasites and bacteria, the stools become normal. Or the stools go from constipation to diarrhea, and we'll talk about that in a little bit when you go on that diet. Probiotics are very helpful for this as well. So when I keep thinking about our stools, and I'm thinking about the gut and the microbiome, which is the fancy word of saying the rainforest of critters growing inside of us, and we're just learning about that. This is interesting to see happen over the past 15 years, how probiotics were really just odd things that those weird doctors use to now mainstream. You're seeing it on commercials. In fact, in hospitals, if children are on antibiotics for a long time, IV, they actually start giving them probiotics. So it's becoming mainstream now. But what we're trying to do is we're trying to diminish or treat in a more natural way this word called dysbiosis, just meaning that bad bugs behaving badly in the bowels. You just got things growing in there that weren't supposed to get in there, and we can do laboratory testing to see what's in there. The testing that I tend to do would be obviously a stool study, but I can also see things in the urine that represent what's growing in the colon, okay? Because the kidneys filter all the toxins, so we're going to see toxins in the urine that are only there when you've got strange bacteria growing, okay? We'll do fungal cultures and parasite cultures. You can't see on this slide too well because of the way the screen's set up, but this was a picture showing that this child had parasites in there, had white blood cells, which is pus, in the stool, and basically we had parasites that needed to be treated. Where do they pick up these parasites? These kids put a lot of things in their mouth, and they get them. This is yeast. It's a picture of yeast. We call this in medical school the spaghetti and meatball sign. and this needs to be treated as well. Yeast can make these kids just crazy. We'll talk a little bit more about yeast in a bit. But we can culture yeast, and one of the names is Candida, and even though they have all kinds of good healthy bacteria growing on a scale of 0 to 4, they're 4 plus, yeast can still grow. Why? Because the immune system doesn't see yeast as being a pathogen, as something to destroy. So yeast will grow in the gut. But these kids generally can be very giddy, up at night laughing. They can have a bloated belly. I call that the Prager belly look. They can have a lot of gas. They could smell like a bakery. They love to climb and hang upside down. Okay? But generally, it really affects their sleep and their moods and their behaviors. So there are treatments that I can use, but there's some natural treatments that my families can use as well. I'll use antifungals. I mean, if you got a yeast infection, I don't mess around. I use an antifungal. I can use what they call the azoles, like fluconazole or ketoconazole. I can use nystatin. Nystatin is what you give for thrush, which is a yeast infection when the babies are little. If I have them on any of these medications for a while, I do have to check their liver functions and blood counts as well. Yeast treatments that are more natural, I've listed them here. We can use a lot of things to manage yeast in the gut. Not quite as good. I think that once you get a true yeast infection, it's probably better to use a medication that kills yeast, and then we can rely on these to keep yeast from growing back. This is more of an inhibitory as opposed to trying to treat. But if you don't have a physician who can do this for you, then obviously we'll rely on these for treatment. And they can be effective too. If you've got some really bad bacteria growing in the gut, probiotics are very, very helpful, making sure you're not constipated because bacteria love a stagnant, brackish sewer system. So if that sewer system is plugged up, things are going to grow. And the best way to get rid of yeast or bacteria is down the toilet. So we got to get them going. I, of course, can use some antibiotics if I need to. But what I'm trying to illustrate here is that there are treatments that we can do that are usually being ignored. And we also have treatments for bacteria that can also go after parasites like metronidazole. And then we can go after parasites with some of our anti-parasitic agents. But these can be affecting our behaviors of our child. And whatever your child does, if I can take that child's behaviors from an 8 out of 10 on the Richter scale and bring it down to a 2 or 3, that child's happier, parents are happier, the siblings are happier, and hey, maybe now grandparents can watch the child and you guys can go out and do something different, which is kind of fun. Inflammation of the bowels. Inflammation of the bowels. That's where we're going next with our talk. And we're going to kind of take a survey of the GI tract is what we're doing here. Inflammatory bowel disease is a big problem with probably 15-20% of the kids that I take care of. They truly have IBD. And this was a very cool study done on children who are on the spectrum where they actually swallow a camera. They actually swallow a camera. It's called a pill cam. And Joshua, my son, was one of the first kids to do this in Dr. Kriegsman's practice. And what we're able to do, when we do endoscopy, they stick a big hose down, and you can look down into the stomach, and can't go much further than the stomach. But remember, after the stomach, you have the duodenum and all the small intestines, and then they open up to the large intestines. But all you can get is to the stomach. And then you can actually stick it up the hiney and get the large colon, but again, you miss the small intestines. This is the first time we can see in a living individual what's going on in the small intestines. As that little pill cam goes down the track, it's got a little flash, it takes pictures, it transmits it to a little buddy pack that the person wears, and then the pictures are recorded, and then, of course, the GI doctor has to look through like 1,000 pictures. But all of a sudden, they can see all kinds of ulcers in the small intestines. Maybe our children are doing self-injurious behavior. Maybe our children are irritable and cranky all the time because their guts hurt by something that's treatable. If you recognize it and you treat it, then all of a sudden, they feel better. So these pictures here are a little hard for you guys to see with the lights and everything, but show inflammatory bowel disease, a treatable condition like constipation, like diarrhea, like reflux, a treatable condition to make your child better. So here you can see, maybe you can see this, but there's like this halo around here. This is ulcered, like a canker sore ulcer. Their whole intestinal tube is lined with these little ulcers. Painful, but treatable. Sometimes these are caused by viruses, kind of weird, so we can treat them with antiviral. Sometimes it's autoimmune, and we could treat with intravenous immunoglobulins. Sometimes they're autoimmune, and we have to treat them differently with autoimmune treatments. We could treat them with natural anti-inflammatory agents like curcumin, omega-3s, managing some of their pain, at least initially, with ibuprofen. Sometimes I'll use L-glutamine. The GI doctor will use medications like mesalamine or budesonide, oral steroids, just to get a control on the inflammation and bring healing. Obviously helping with regular bowel movements, zinc, purified distilled aloe, fiber, and probiotics are going to be very important. Main thing is, what I'm demonstrating today is that these kids have other medical problems that have to be figured out. They're treated. Our kids are going to get better, which is very, very exciting. All right, so one more thing about the gut. Let's talk about reflux. Reflux is bringing up the stomach contents into the swallowing pipe. The swallowing pipe's called the esophagus, and when anything gets inflamed in the body, we end the word with itis. So tonsillitis, appendicitis, this would be esophagitis. Esophagitis is what they would say. And it's common when you have allergic or noxious stimuli in the stomach. The stomach will burp up, will reflux things it wants to get out of the system. It's associated with ear infections, sinus infections, asthma. Dietary changes can help this. Antacids promote the healing of the inflammation because you're telling the stomach don't make acid, so you're not going to be acid washing the swallowing pipe, the esophagus. But it doesn't stop the reflux. It just stops the caustic damage that's happening from the acid. Gastric motility, moving things out of the stomach are very important. And of course, if the gut's blocked up, like constipation, that can be a problem. So the reflux treatments, well, this is a picture of reflux. And I don't know if you guys can appreciate this, but this area here, we call that cobblestoning because it looks like a cobblestone street. This is normal, nice and smooth and pink. Cobblestoning, this is reflux. And this is this is just an inflammation of the esophagus. It hurts. Bottom line, it hurts. And you don't want your baby in pain. So treatments are, well, we've got to remove the exogenous allergens. That's diet again. Fancy word for saying diet, changing the diet. Parents hate to change the diet. Changing the diet. Obviously, we can put them on antacids like Pepcid, Zantac, Prilosec, Tagamet, Nexium. But remember, those just treat the acid problem, the burning of the swallowing pipe, but they don't actually treat the reflux.